Hello guys, how are you all? I hope you all are really good. So welcome back to my channel Dipan Vidcast again with another very informative video. And the topic of today's video is how you can avoid the situation when HCPC asks you to provide further information, and if at all you get this email from them regarding your that you need to provide further information, then how you should tackle and how you should reply back to them. So today's video will be complete information regarding this topic, so stay tuned, watch the full video. So first of all, you should know why HCPC should send you this further information request, like in what circumstances they will ask you regarding further information. So the two more important thing about this is, if you don't write your professional experience section very nicely, like giving all the details they want, and the second thing is like your course information from does not content does not have all the information, like the course information from is not that much detailed enough to give them an understanding of what you have studied in your course. So in these two kind of situation, they mainly ask the further information from you. So I would suggest, whenever you are applying for HCPC registration, be whatever profession you may be, like radiographer, physiotherapist, biomedical scientist, anesthetist, OD, whatever your profession may be, please go back to the HCPC's website, the new standards of proficiency, and read all the points there before you apply, and make sure your professional experience section and your course information form does have all the information. And please make sure your course information form should have as much as details as you can provide. Okay, and for how you can write a good professional experience, I have a video on my channel. You can check the description link for the video link. And also how you can write course information from the new course information they have introduced from September 1. Also how you can write it, it's available on my YouTube channel. You can check out the video. If you want any query, if you want to contact me regarding anything, you can message me on Instagram or LinkedIn. I'll be happy to help you guys. Okay, so now I will be going to discuss some of the most common case scenario, like what are the main reasons the HCPC will ask you regarding further information, and if at all you get it, how you can reply back to them. So I'll take some of the case scenarios and most common reasons why they are asking the further information from you. Okay, so just let's go to my computer screen. So first of all, you will be getting an email like this from HCPC requesting further information with all the necessary attachment that you must go through before applying for further information. So if you go continue with the mail, so you will see there are a lot of details, like we have included guidance how to submit to us attachment to this email. This includes guidance on further information we accept, verifying the information we provide. So there are a lot of things you have to read about these things in the mail. And important thing is you have to reply back to them within 28 days of the email you have received. And if you don't do it, then they may, like, whatever you have provided based on this, your application may be get rejected. Okay, so make sure you reply within 28 days of reception of this email, and the outcome from the accessors you will get within 2 months time. So you can read about these things here. So this is the guidance for further information submission, so you can read all those things here. But I just want to say that further information request is not a dead end letter. If we are asked to produce further evidence, it means HCPC assessors still see a chance for you to register. If they haven't seen a potential, they would have closed your application or asked for an aptitude test straight away. So there is a still chance for you to get registered. So there are a lot of things they have mentioned, like further information they accept. You can just go through it. Verifying information you provide, like just put official email or no, like that, and don't copy from others. So you can read about it, all those things here. And here you have to, there is a cover sheet as well, so make sure you are submitting the cover sheet with your signature. Okay, so here is the example. So if they're asking for your professional experience,
Then you have to like evidence type, in column 1 you have to say professional experience and start date, end date. Also you have to give the contact details with whom they can verify your professional details, and if anything related to your training or related to your course information from, then also you can just give your start and end date of the course, your course administrator or your college or university official email, and just attach the paper, uh, the new updated course information from with the when submitting the further information. Okay, and make sure you are submitting further information in one part. If you submit in multiple parts, then they may consider only the first part, and if your first part doesn't contain all the information, then your application may get rejected. Okay, so just you can read all those things here. I'm not going too much detailed here. So here you can see the further information cover sheet. This one is really important. You have to fill it up with your sign and signature, otherwise they won't accept your submission. Okay, so this is the first record assessment. This is the PDF file, the part of your email attachment. And here, why does the qualification not meet the standard? They have outlined some of the points there, like insufficient information has been given regarding scope of practice training, able to assess a professional situation or not, determine the nature and severity of the problem, and able to make reasoned decisions, able to manage complex and unpredictable situations, able to perform full range of standard imaging techniques including those undertaken. So basically, in this PDF file they will outline the points that is lacking in your application, and they will also mention what are the areas of concern and what they exactly want from you to submit as a response to the further information required. So the problem is, this one is related to your professional experience. In your professional experience, the candidate have not like given detail, like what are the studies he is doing, how he is assessing any problem, how, is he autonomous to do, is he independently can perform the like radiological studies or whatever it is, be it in any course, physiotherapy or anesthesia, wherever you are. Like they will mainly see whether you can judge the patient condition, perform your task independently, autonomously. So these are the things. So make sure whenever you are writing a professional experience, you uh, you cover all the points in a professional experience, and refer to the HCPC's standards of proficiency in their website, and make sure you have covered all the points there. So these are the requirements they are asking. Also, the information provided is limited and does not demonstrate the range of scope of general diagnostic radiography X-ray examination required to meet the standards of proficiency. So according to the radiographer standards of proficiency, the information he has provided does not demonstrate, like what they are expecting is not living up to their expectation. So you can read about all these things. So you can see here standards of proficiency, 4.1, 4.2, 14, 11, 14.27. These are the points you have to refer to the standards of proficiency and see what is missing. So you have to write about this thing. So areas of concern, far from the full range of general and special diagnostic radiographic examinations. So when you are writing your professional experience, make sure you are writing what are the studies, what are the cases you are doing. Okay, and whether you are like, see, perform diagnostic radiography imaging examination, acute trauma or non-standard imaging. So whether you are doing trauma or non-trauma, what are the ranges, what are the categories of patient you are doing, practice as an autonomous radiographer, like I was telling, whether you are autonomous or independent while doing the radiography, and are you able to take decisions when you experience or when you come across a delicate incident or in a difficult situation, how you are judging the patient care, like that. So for everyone, areas of concern, they will mention what are the things they need from you. So you have to make sure you are writing your professional experience nicely, covering all the points and sending them back. So what they are suggesting to applicant to provide is detailed regarding general and specialist diagnostic radiography clinical training during the studies, the numbers and types of standards and special diagnostic radiography imaging examinations like the scans or whatever it is. This could be some very log books or any, but you can also get you get a letter of maybe 2 or 3 pages mentioning all the things, and make sure your who is referencing you for this, they put their seal and stamp, and whenever you are adding this, make sure you're giving their contact details so the HCPC can verify with them. And also you have to give evidence that practice as an autonomous professional exercising by own professional judgment with standard and special diagnostic radiography examination. So this is another radiographer application who need to provide further information as requested by HCPC. So if you can see here, the applicants qualifications and experience do not provide information that is relevant to the following standard of proficiency. They have mentioned 12.1 and 14.35, so they remain outstanding. So if you go to the next page, why does the qualification does not meet the standard? So you'll see they've mentioned the course information does not provide sufficient information, or it is unclear if the applicant has studied evidence-based practice, is able to evaluate practice systemically, and participate in clinical and other audit procedures. There is insufficient information related to the evaluation of images for traumatic and pathological processes. So as I have told you before, you have to be very cautious while regarding your course information form. The course information form should have as much as details so that the assessor know that you have done these things. And also in the new course information form, they have evidence-based practice section, and make sure what are the evidence-based practice you have done and what did you learn from that. Okay. And also insufficient information relating to evaluation of images. So make sure when you are writing your professional experience, you include the point of how you evaluate images for traumatic and pathological processes, and what you do if you will see a urgent attention, any critical diagnosis. If you see, what should you do, what do you do normally? So this is another radiographer which HCPC have asked for further information. So this is also same thing. They have ability to participate in based party. So they are unable to interpret images across full range of imaging modalities, and can recognize diseases and trauma processors that manifest on images. So you have to make sure you are including this in your professional experience. This is also another radiographer, the same thing like that I have mentioned. This is another radiographer thing, same, they have not they have asked whether you have ability to distinguish between normal and abnormal appearances in the images. So you have to write clearly in your professional experience regarding this. How do you do that? Another radiography. And now coming to the ODP, that is operating department practitioner, that we normally call the anesthesia. So this is one anesthesia technician whose application they have asked for further information, and they have mentioned that applicant is required to provide detailed and validated evidence in relation to their practice as both in the surgical scrub and circulating practitioner. And the applicant must clearly demonstrate what knowledge and skills and how these have been developed to be able to safely practice as an operating department practitioner within these roles. So you have to read about it. So as I was telling before, whatever profession you may be, make sure that you, in respect to your profession, you are writing your professional experience such a way that they should understand that you are capable of doing your things, capable of judging the any problem or any assessment methods, or they need any case studies regarding that. Everything you have to mention it very clearly. So in the other point, they have mentioned the applicants' practice skills do not clearly demonstrate experience of knowledge or skills developed for practicing the duties, responsibilities, or provision of care interventions as part of the surgical scrap and circulating rules across a range of procedures, surgical specialties, operating department practitioner role. So you have to, like, as I told you before, you have to now write how you do this, your, like, your duties, your responsibilities, how you provision of interventions as a part of surgical scrap and circulating roles. So you have to now write about in detail how do you meet these requirements in your reply to the further information requested. Okay, see, there is another one for anesthesia technologist. Like, they have mentioned the qualification does not clearly provide evidence of theory, topics and content, and clinical practice studied, or being able to practice the duties, responsibilities, and provide care, and like blah blah. This one, because of the applicant's course information form was not up to the mark, it was not maybe that much detailed, so they were asking about the evidence of theory of your course. So this is another radiographers HCPC application. Maybe in that also they have not provided sufficient information, so they have outlined the points here. And in these points, it's like similar what I have shown you before. So if in any time, if they ask you about are you autonomous, like, so in that cases, if they ask you to describe your autonomous practice and independent assessment methods, you need to write down about the assessment approaches, provide an example and reasons why a particular assessment tool was used. So you have to, like, again describe all those things in your reply to them, that you are independent, you can do your job autonomously. All right.
So I hope guys you have got a really good idea about in what are the cases and what are all the circumstances that HCPC may ask you regarding further information, and what you should do if you get this kind of email from HCPC. Okay guys, so please subscribe my channel, share with your friends. Thanks for supporting, and till the time I come up with another video, take care of yourself. Bye bye.